Hello everyone. In this short discussion, I will talk about cold abscess. To start from the definition, cold abscess is defined as slowly progressing, non-reactive, that means white and cold instead of hyperemic and hot, and low tension, that means so painless. Abscess resulting from causation is called cold abscess. Regarding etiology for cold abscess, infectious due to tuberculosis and fungus like blastomycosis is the most common cause. And persons with hyper IgE syndrome is more predisposed to have cold abscess. But in most part of the world, tuberculosis is the most common cause of cold abscess. There are three stages of cold abscess. The first stage is stage of lymphadenitis. In this case, there is painless, mobile, and discrete lymph nodes. In the stage of periadenitis, there is a mass of matted node fixed to the skin, whereas the late stage is, in this case, the node can undergo several changes by healing by fibrosis, causation and liquefaction, and also cold abscess bursting either through deep fascia into subcutaneous tissue forming collar stud abscess or forming a sinus through the skin. When we see some of the clinical features of cold abscess, first of all, earlier there is some solid neck swelling at earlier stage, as we have said, and then this is followed by softening following a pre-existing solid neck swelling. Nodes mainly are in the posterior triangle and the absence of signs of inflammation. And also constitutional symptoms of tuberculosis like evening rise of temperature, anorexia, weight loss, secondary infections of the abscess, and also matted lymph nodes palpated on deeper aspect, and aspiration reveals a caseous material. Tenderness of cervical spine might also present if bone involvement are there. When we see the investigations needed for those having cold abscess, CBC, in CBC, most of the time CBC shows us lymphocytosis because most of the time the cause for cold abscess is tuberculosis. ESR is raised, tuberculin skin test can be positive. Chest X-ray might shows the primary focus of that of the lung, and AFB or gene expert should have to be done from the aspirate of the abscess, and the culture and ultrasound of the neck swelling, and also ultrasound or CT guided FNAC. Regarding the treatment is classified as general and local. In the general one, non-specific treatments such as bed rest and multivit supplementation, and also specific treatments such as anti-TB drug if the cause is tuberculosis. And the local treatment is for non-dependent aspiration observation with only anti-TB drug or cause treatment, and surgery is indicated for just to confirm the diagnosis by biopsy or localized abscess which is not responding to anti-TB drug or chemotherapy, and also surgery is indicated if there is persistent sinus. This is all about cold abscess. Thank you for watching.